upon the mankind. Mankind, they will survive by their intelligence. Already various countries in the world have started producing the various vaccine. Russia has declared that they have discovered the vaccine. America is saying that this year they will also produce the vaccine. India is also going ahead. India will also produce the vaccine very shortly. And so many other countries, developed countries, they are very much concerned about this matter, and they are trying to produce the vaccine to combat the pandemic situation. Earlier, the malaria and various types of diseases caused a serious disaster among the human race. But by production of the vaccine, so many diseases has been eradicated. Malaria, pox, so many others. So we think our scientists, our technocrat, our expert, they will do needful to resist this serious problem. Examination of the eye health is very, very questionable now due to the pandemic, due to coronavirus. However, I am not expert in this field, but I can feel the problem. So I hope that our experts, our faculty members, and our scientists, experts, they will put the role of the endeavor to eradicate this virus. I hope by this year, this virus will be eradicated by the use of vaccine. We will win, mankind will win. This is your expectation. This vaccine, COVID-19, has come as a curse to the society as a whole. So the scientists, technologists, academicians, all are doing their best to produce the vaccine in order to eradicate this sort of disease. I welcome all of you. Good Good morning, good afternoon, everyone, for joining this webinar. I will not speak more. I will not prolong my speech because I have a little knowledge about this subject. From my experience and from my general knowledge, common sense, I am speaking. So no need of speaking more about this matter. Good day. With these my words, I give my thanks to all of you.
Thank you so much, Chairman Sir, for sharing your views with us. Now, it is my great honor to request our Director Sir, Dr. Soumendranath Bandyopadhyay, to enlighten us with his views. Sir, please.
Extremely sorry, it took a bit of time. So getting it adjusted with the system. I welcome all the guests who are here. Dr. P.B. Sarkar, Senior Ophthalmologist and Director of Saltlake Eye Foundation. Now I'm reading out the names because first time I'm meeting you, so it is not there in my brain. So I'll be reading out a bit. Then of course I welcome Bibek Pratap Singh, Consultant Optometrist, Saptak Banerjee, again Optometrist, Ranindita Saha, and Jiaul Baksh. So welcome all. Before we go into the webinar, first and foremost, I thank Chairman Sir, Dr. Lakshman Seth, for giving us the opportunity to talk to you and have this webinar and discuss about the ophthalmic developments and the things that are going on in optometry. I congratulate the Optometry Department headed by Goutam Babu and of course Ranita doing a beautiful job today as a host. So I am sure the students of the Optometry Department will learn a lot from this webinar. They will interact with the hosts and find out what are the parameters that we are looking into in the ophthalmic development during the COVID-19 situation. Before I go into a bit of introduction to the webinar, I'll just give the three parameters I think where our speakers can talk about. So the first parameter is the symptoms. So once we talk about optometry, we know that COVID-19 will enter your body not only through your mouth and nose, it can enter through eyes. Now, of course, if I look at you, it will not enter. But if I touch something, and again, I touch my eyes, then the COVID-19 virus can enter through your eyes also. So that is one thing, and the government has been telling us that do not use your hand too much to prickle your nose or your eyes at this point of time. So that is one kind of thing that we need to take a preventive measure so that we are a bit safe from the COVID-19 virus. Then comes in COVID-19, do you have some symptoms or ophthalmic symptoms? Yes, we have some. Recent journal I was going through shows that 1 to 3% of the COVID-19 patients have conjunctivitis. So now, this, I think our experts will talk more on this, the pink eye syndrome. So why conjunctivitis is happening in COVID-19 and why only 3% of the population, why not more? So yes, the population count is pretty less. Maybe it was a kind of a survey where the total population was taken less, so the percentage is less. But further, we can do further research and find out if this population goes on or the percentage of conjunctivitis increases or not. Second is, apart from the problems that we are facing, what is happening with people who already have some eye-related problem? Now, the situation in West Bengal or India, or maybe the world is like this, like if somebody tells us now go to the hospital, we are a bit afraid because we are afraid because we'll go to the hospital and catch the virus and come back. And or else we'll be told to go for a 14 days or 21 days quarantine. So this fear psychosis, is this leading for eye problems to increase and people are visiting hospitals less? So they are not getting the proper checkup or not. And that may lead to a future problem when they go. So as in medicine, you always say that early you go, early detection, early cure. But if you keep that prolonged, then your cure time will take time also. So that is another parameter who I think the guests can talk about. And finally, the work-related hazards. Like I'll tell an example of my son. My son does online classes in the morning. After that, he does all his homework through online. And in the evening, he plays a bit of Garena Wildfire or so on and so forth. So he's always in the net. And not only my son, even us. Whenever we are doing something, we take out our mobile and just see the mobile a bit. Is this good? And because now the children cannot go out, we are doing work from home, majority of the people. So that is also hampering the eye health. So these three parameters, so maybe the symptoms, a bit of care, and the bit of the work-related hazard. So you have a SCH together that is playing havoc in the ophthalmic division of our body. I'll not take too long because the experts are there, and I am very happy to see a large gathering of optometry students here. So it's great to see the students. Please do interact with the guests, and I hope you have a very good webinar and you learn from this how to take care of your eyes. And without further ado, I'll hand it over back to Ranindita Madam.
Thank you so much, sir. Before starting with our expert panelist speeches, I would like to express my gratitude to our visiting faculty, Dr. Somishubra Mukhopadhyay, sir, for his immense support to organize this webinar. Thank you so much, sir. Now, I would like to introduce our very first eminent speaker, Dr. Purnendu Bikash Sarkar. He is the medical director of Saltlake Eye Foundation, Kolkata, a very reputed and compact eye care center with new age equipments. Besides serving people for over 25 years, he has done a commendable work of Robindra Kobita archive by digitalizing the Rabindranath Tagore's poems and Rabindra Sangit and many more in a single pen drive. Sir, please enlighten us with your thoughts.
Good evening and welcome to all. The webinar which are going to discuss today, I think is very important in this situation, because of one thing is clear that before COVID and this time, see and think about the psychology and position of the patients. You see, before COVID, when we were doing a clinic in our chamber or something, a lot of patients were coming, waiting for us, and we had no time. We had very little time to treat all of them. But in this period, you see more than 30% patient has dropped. We are getting less and less patient. Then where the patient is going now and how they are managing their problem in the eyes, etc. So here comes the main thing. The rush in our chamber, which we are seeing in pre-COVID situation, and the less patient in this time. Less patient in this time. So the balanced patient who are not coming, who are not able to come to the clinic for their eye disease or problems, etc. How to manage them? This is the first question. Disease is there, doctor is there, but in the middle there is a gap. A gap is the fear of COVID. So we have to overcome this unnatural situation and go for and treat the patient. Now, the second question is how COVID is affecting the eye. We know that COVID is usually people suffering from. Actually, we know nothing about COVID. This is a very new thing. We know nothing about COVID. All assumption, all are this and that permutation combination. But we are seeing the morbid patients, aged patients, and the patients who are suffering from mostly from the diabetes and respiratory problem are the sufferers of the COVID. But the young patients with good health, nothing, they may be affected, but they may not suffer so much with the COVID. Now, conjunctivitis in case of COVID is the main. I think this is the main thing we should be careful about COVID and the eye problem. So when we are seeing a patient in a clinic, eye doctors have to go very close to the eye close to the patient, and they are very high risk factor is there. So there should be some thing so that we can manage the patient, we can treat the patient, at the same time we can save ourselves, doctors. So you know nowadays we are putting the barrier between doctors and patients, and before that, before COVID, in case of conjunctivitis, we are doing tests like cornea examination by putting eye drops and going very close to the cornea. Nowadays we should not do that one. I shall tell something about that, how we are managing the patient like that. And secondly, I think the main weapon against the COVID is the mask. If you do not touch the T-zone, mouth, nose, and eye, 85% patients will be saved from the COVID. So mask is the only thing, maybe main thing to prevent the COVID. In our clinic, we are using PPE, we are using masks, we are using sanitization, we are fumigating our chambers. When a patient coming to the chamber, we are doing thermal checkup, we are doing seeing the pulse oximeter, parameter. All is okay. But the main thing, mask should be in the eyes. You have seen when patients coming to the clinic and expressing their complaints, they are putting down the mask because they cannot. They are thinking they cannot express their symptoms through the barrier of the mask. They are putting down the mask. That is the most dangerous. And secondly, we should say the patient talk less. How talk less? They can come in the clinic by writing their symptoms 1, 2, 3, 4, 5, and they show it to the doctor. Patient coming, Dr. Sarkar, I have some eye disease, I'm suffering from eye problem, watering this, and they're telling for 1 minute. But the 3 or 4 silent pictures, if you can write in the picture, paper and show me, this is a very good thing to prevent infection from patient to doctor, to the spitting of the mouth. And third of all, the social distance. Patients should not gather in the chamber. They should wait outside. They should come one by one and see and get the service of the doctors. This is the first point I am saying. Ranindita, I will say something about Ranindita. Over to Ranindita. Then I will say something about hearing your opinion about this. Bye. Ranindita, I'm done. Right over.
Thank you so much, sir. Now, our next speaker is our very own Dr. Goutam Pradhan, sir, the head of the Optometry Department. Sir, please say a few words.
Good evening, everyone. Thank you, Ranindita. First of all, I want to thank all the guests on behalf of our Optometry Department, Purnendu management. I am grateful that it could be able to take some time out of our busy schedule. Give my pleasure to listen to your expert view, the opinion about the matter. To the discussion is the great honorable for me get the chance of view the world of harmful COVID-19. The Honorable Chairman, Dr. Lakshman Chandra said, Honorable Secretary Sir,
Sri Asish Lahiri, Honorable Advocate Sir Sri Sudipton, Seth, Vice Chairman, Holdings to Management, Honorable Director Dr. S.N. Bandyopadhyay, Director of HIM, the next speaker, Dr. P.V. Sarkar, and Bibek, Pratap Singh, Saptak Banerjee, Ranindita Saha, Jiaul Baksh. Once about the genetic novel coronavirus strains the several acute respiratory symptom COVID-19. The serious COVID-19, which is the cases, discuss the COVID-19. This is the virus family RNA virus called coronavirus is the cases of disease, anomalies, birds in human, speeds of grateful case. Respiratory tract infected that can vary from mild and lethal form. Mild for cases, including the common cold, while more the lethal virus cases, SARS and MERS and COVID-19. First, respiratory, the December 2019, Wuhan of China, COVID-19 has cases worldwide pandemic, which has left us our unexpected situation. We are all still figure coronavirus with around 70 lakhs active case for 873,285 confirmed the around today. Indian around 8 lakhs active cases, more than 68,569 for that. Our amount for 3 lakhs activities of today. The symptom case COVID-19 may around fever, dry cough, and tenderness, loss of small for the throat of the patient. Who is the connected novel coronavirus may be present with the ocular problem, conjunctivitis, or pink eyes on our search of the symptomatic disease. Viral conjunctivitis present upper respiratory tract system. Tract infection symptom disease of very few of trouble of the human body. The journal Medical Virology recently published studies on 30% is being treated the COVID-19. Only one patient them was the diagnosis of conjunctivitis. Another respective studies hospital across the China has published the New England Journal Medicine. According to the studies, conjunctivitis cases of red or infected eye found of 9 to 1099 patient on 0.8%. With confirmed diagnosis according to infection, through the basis the information we can start according to conjunctivitis in the law of COVID-19 patient, but concluded the body fluid infection patient for continuation viral strain would not be the impossible. There are the is risks of TR, conjunctivitis as testimonial discharge from infection from the patient, sure of communication. Our articles, documentation course of 2 cases conjunctivitis, the mobile of hospital during the coronavirus is disease 2019 pandemic was the published GMCO ophthalmologist and 27 August 2020 with the document conjunctivitis treated positive cases serious COVID-19 2. Virus is 29 years old, as male, and 51 years old female patient is come for nothing. The event may to the happen that the person touch infection suffers than the touch for the eyes of face. The virus can the enter body of circulation. Therefore, the stop of spare edically virus we have to including some of modification our day-to-day practice of eye care, proving facility in our everyday of practicing hamper. Social distance wearing, masks, frequent hand wash with the step, sanitizing some of most important generally practice being the following the reduced speed of coronavirus. Some of the harmful, useful of the eye, the is practiced to make the faithful are not to the rough and eye. Avoid going outside out as the much as the possibly. Wearing the sunglass or prescription sunglass where they going to the avoid wearing the contact lens, such of the possibly, etc. I will not take the much your time as our other immediate speaker, best of person, discuss.
Thank you so much, sir. Our next speakers are from LV Prasad Eye Institute, Hyderabad. I think LVPEI needs no introduction as LVPEI works in collaboration with World Health Organization and is the #1 ophthalmology institute in India. Our next speaker is Mr. Bibek Pratap Singh, who is basically from Nepal. He is ex-PGDOVS from LV Prasad Eye Institute, and currently he is a consultant optometrist in Child Sight Institute, Lusaka Eye Hospital, Zambia. He will be traveling to Zambia within the next 2 days, but still he is attending our webinar in spite of his really busy schedule. We are really grateful for that. I would now like to request Bibek to deliver his presentation. Bibek, please.
Yeah. So good evening, everyone. I think my voice is audible to everyone, right?
Yes, it's audible.
So good evening, everyone. First of all, I would like to thank Honble Institute for giving me this opportunity about the change in eye care during this pandemic for speak up. And then I would like to thank Mrs. Ronita Roy for frequent communication to make this happen. During this eye examination, as an eye care professionals, we have to go very closer and then we have to see patients. So in this case, we are more prone to have uh, like infections. So it's very useful that if we have to use all the precautions like using masks, safe hand gloves, and face shields while we see patient. And then the coronavirus, the COVID, it was first it was first like has been introduced like one of the ophthalmologists in China who have given like theory that there is some pandemic going on, and then the Chinese people has believe on them, and then they have discussed about it. But I will not take much time, and I will go to my discussions like as all the countries going through the lockdown. So most of us, we are in home and we all are using all the gadgets like using mobile phone and laptop for like extended time. So we will have a eye strain problem. So we can have eye strain. So if we'll go ahead and see the pandemic of eye strain and non-strabismic binocular vision disorder. So if eye strain is nothing but if we describe, it is a group of symptoms which occurs in some people after extended use of the eye, such as extended use of reading or working on computer or mobile. And in optometric or ophthalmology term, if we'll term it as, it is an stenoptic symptom what patient can have. And in stenoptic symptoms, headache is one of the cause for eye strain, blurring of the vision, dryness, double vision. Like it's not it's not permanent double vision, it will be occasional double vision. And due to dryness, sometimes we can see redness, as previous ophthalmologist used to talk about pink eyes. So that can be one of the reason in coronavirus. But for eye strain, redness is because of the dryness, and blurring of vision, headache, these are the symptoms. Cause can be stress, sleep deprivation, and refractive errors. Sleep deprivation is nothing but lack of sleep. If you have lack of sleep, you can have stress. and then you can have eye strain. Treatment is like it's nothing like it's a change in a lifestyle. Like you, when you are doing work for a long time, then you blink often to refresh your eyes. Take eye break like 20-20 rule. For after 20 minutes you have to see, you have to blink for 20 times, and then adjustment to the monitor which wherever you are working. It's very useful if you adjust it properly to the monitor. And that's all I have to say. So there is a pandemic, and if we have like eye strain, there is a chance of getting non-strabismic binocular vision. Like we can have continuous use of mobile phone or gadgets, if anything. It can lead to some accommodative problems. It can, and as nowadays like all the children are involved in like mobile phone and gadgets, so they can have myopia in future. So this lockdown is basically, it can there are a lot of role to play in play for optometry, by like giving awareness regarding this eye strain and myopic. Like they should reduce their gadget times, and they have to take care of their eyes. That's all I have to say. Thanks a lot. Thank you so much, Ronita, for giving me this opportunity to speak up. Hello.
Thank you, Bibek. Can you
Yeah.
please put off your slide?
I had not shared my slide. I think there is some error going on in my laptop, but still
Okay, it's done. It's done, Vivek.
it's done.
Yeah,
Yeah.
but you have again started the screen sharing.
No, no, no. I'll just cancel it.
Okay, thank you. Thank you, Vivek, for your wonderful presentation. Mr. Saptak Banerjee, our next speaker, is an ex-PGDOVS in LV Prasad Eye Institute in Public Health Eye and Community Optometry. I would like to request him to share his thoughts with us. Saptak, please.
Hello, am I audible?
Yeah, you are totally audible.
Yeah, good evening, everybody. So first of all, thanks a lot for having me in this noble initiative. So I'll basically talk about, so can I share the screen here? Hello?
Yes.
Am I audible?
Yeah. It's visible.
Yeah,
And
so hello,
audible.
everybody. Yeah. I'm facing some network here. Yeah, so I'll basically talk about the changing trend in the community eye health examination. So if you see in this situation, the greater effect has fallen on the society of the poor and the lower middle class economic section. So they are suffering the most. So till now we had a protocol, we had a process so that we can go to the villages, we could check the eyes of the rural people and the people who are in a vulnerable situation. But as of now, if you see, these are not that much easier in this situation. So if we just talk about the current scenario that's going on right now, we already had a large burden of visual impairment in our country. And if you see that all over the world, that's 285 million people are visually impaired. And among those, more than 1/4, that's 68 million people are visually impaired from only India. So you already had a large burden. And over that, some uncalculated incidents we had of the visual impairment in our country due to this period, because no people can go to the villages, no people could go to the countrysides and the slums to see whether visual impairment is arising or not. So we have this burden. And second thing, most of the hospitals only emergency department is open. So the regular checkups and the normal people, normal patient cannot come to the hospital. So if you see, greater threats lie in the regular checkups. We can know who is having glaucoma, who is having some retinal issues, at least who is having some uncorrected refractive error. We can know from the regular checkups, but that's closed as of now. And the private clinics and the local optical stores, which serves a large population and at a large stake of the service, around 90% of the opticals and clinics are not open right now. So these is the current scenario. So how it's hampering? If you see the IAPB 2017 data, global visual impairment data, it's saying that more than, not more than, it's around 50% of the visual impairment is because of uncorrected refractive error all over the world. So in the same article, they are saying what are the problems people face because of this: blurred vision due to uncorrected refractive error, and three most important things: broken glass or scratched glass, lost glasses, or old glasses. These were the scenarios we had before. But right now, in the COVID-19 situation, most of the hospitals are closed. We don't have any openings of the secondary center or the primary eye care center, which is situated in the rural place. So people cannot come to the centers. So they are facing a lot difficulty. So what are the common patterns we do in the public health or community eye service? The primary center, secondary center, tertiary center, this flow either we follow or we follow the static or mobile eye cams. A lot of poor people who are living under the poverty line, they depend on the glasses given from the camps. So if you see in this situation, the people who can come to us, who can avail a taxi, who can avail a private car, it is still fine for them to come to the hospital so that you can check them. But who don't have that privilege, those who don't have the money, how can they come? How can they come? So it's our duty to go to their place and to see. But what will be the ways in this new normal situation? It's gonna be very difficult to go to the places, remote places in this situation, because nobody's gonna allow you. And over that, you're not gonna get some transport. It is locked. Most of the ways it's locked. So these are the demerits of the new normal situation. There are a lot of demerits, but among all those, we got 4 prime factors. First one is the inactive primary eye care centers. Those are located in the rural places or suburban places in the villages. So those people cannot go to those clinics in this situation. Second thing, even if they want to come to the secondary center, they cannot come because public transport is not there. Third thing, even if some people of them, like for say 10% of them can arrange some private cars or taxis by their money, it was possible before, but right now it's not possible because of the economic barrier. Because during this COVID situation, a lot of people have lost jobs. Agricultural industry has been shattered. Business had been shattered. So economical barrier is one of the large problems as of now, so that they cannot avail a private taxi or private car. And last but not the least, COVID-19 panic is the greatest one as of now. So nobody wanna come. Still they're suffering with the problem. So what are the things we can do from our side? So we can possibly adopt some theories, but first of all, it's very much needed that we should appoint some more community service providers who are enthusiastic to do so. And second thing, we have to arrange more and more outreach programs so that this can happen. But even if we arrange, how can we go ahead with this? So 2 possible theories we can follow. First one is task, terrain, and threat. This is what Indian Army follows in a war situation. And this situation is no less than a war. If we just justify this situation. So the task should be, how can we gather more and more people who are visually impaired and give them some management? Whether it's a glass or some surgery, whatever it is, we have to give them some management. That's the task. So what could be the possible terrain? We have to go to the villages. We have to the rural places in this tough time when we are not gonna get some transport. We are not gonna get some cars to carry out our instruments. It's a second thing, terrain. Now the threats are coming because of the corona. Nobody's willing to come to you and check their eyes. So these are the three things. We have to solve these three things first. How you're going to do the task, what could be the possible terrain, and how you will manage the threats. So next things comes, even if you manage these prior three things, second is achievable, affordable, and reasonable. What you're going to do is that achievable if you think that you will serve like thousands of patients who are having cataract and you will give them a management of surgery. Is it possible for you or not? First, you have to think that. Second is affordable. Hello? Hello? Am I audible to everybody?
Yes, Saptak, you are audible.
Yes, yes.
Yeah,
you
yeah,
are audible.
yeah. Thank you, thank you. So second, you have to think that whether it is affordable or not. That whatever plan you are doing, you can do it. You are gonna get the grants, or you're gonna get the money to do it or not. Second thing, it should be reasonable at this situation. If you think that you're gonna treat all the enhanced Iskon syndrome in this situation, I don't think that's gonna be reasonable. Yeah, that's your duty to correct all the difficulties of eye being an eye health professional. But as of now, these are secondary things. First thing is you have to see how many people don't have glasses, how many people are going under difficulty because of cataracts, how many people have lost their glasses, like this kind of problem. So how you will go ahead with this? The way outs are, first you have to sample size calculation. You should go through that so that you can make a proper study zone, how many people you're gonna take. Second thing, in every hospital, every clinic, every nursing home, we are having some past data. So this is a time that we should go back and check how many data we have and how many people really have the time right now to come to the clinic, to visit to the clinic. They cannot come because they are under the poverty line. We have that the data in our hospital. So we have to go back and cross check those data. Second thing, we have to list the vulnerable groups. Who are the people who are in a vulnerable situation as of now, who cannot afford glasses, who cannot afford to come to our clinics? Those have to be listed. Second thing is odd one out. The things which doesn't suit our list or doesn't suit our credibility, that should be listed out. Because we are not gonna go for some 6-9 vision. We have to correct up to 6-6. That's not our motive as of now. And the last thing, because of corona situation, nobody is gonna allow you for eye checkup. So we have to build a least touch examination protocol, so everybody can be helped. The second thing is tools. Which tools you are going to use? So even if you go to the villages or any place or slum or any remote places, so if you try to do the retinoscope, it's fine. It will give you the correct result, but that will be that may be hazardous, because the people are not going to allow you to touch their face or touch something. So you can just give a little thing to check their uncorrected diffractive error. Likewise, here you can see that folding phoropter is a beautiful instrument, a very small, very cheap instrument. So it will be affordable to your funding. So you can give it to the patients and you can have a gross checking of their uncorrected diffractive error. So you can correct with that. And second thing, because of the retinal things and other things associated with it, you are not able to take out the big instruments to the villages in the cars. So you can just carry one single portable fundus camera. This is of one company, the Zeiss. I think it's called Visu Scout. So it's very portable. You can have the fundus photo out here. So like these ways you can sort out the problems. But the most important thing is, if you go for perfection at this level, that whether my refraction is correct or not, whether it could be 6.6, but I have just come to 6.12. So I don't think these things are very important as of now, because once Winston Churchill said that perfection is the enemy of progress, I'll just modify this sentence and say, don't let perfection ruin the productivity. If you can correct 1,000 people up to 6.12 within half an hour or 1 hour, but you are just able to correct 50 people with up to 6.6 in 1 hour, I think you know which is acceptable. So don't let perfection ruin the productivity. And that's all I want to say. So even anyone want to ask any question or any other speaker after me? So thank you. Thank you so much.
Thank you, Saptak. Thank you, Saptak, for your wonderful
Yeah.
presentation.
Thank you so much.
Now, our next speaker is Miss Ranindita Saha. She is currently working as research
Am I side
optometrist.
gone or still there?
No, I have put it off. So now I would like
Thank
to request Ms. Ranindita Saha, research optometrist in LV Prasad Eye Institute, to share her opinions. Ranindita, please.
Hello everyone, good afternoon. So first of all, I want to thank all of you, especially HIT team, for having me here. So just give me 1 minute. So my slides is visible.
No,
Yes,
it is not
Ranindita is
visible till now.
visible and audible.
Yeah, visible.
So before like starting, I just want to tell. So if anybody has any question or anything, so they can comment it in chat box. So I will try to reach them after my presentation, and they can also mail me. So as we all know, so from this picture we previously we very much used to with this first picture, like students used to go to school and enjoy all the environment, and they used to sit and play and learn. And now everything has shifted to a small screen, so they have to attend all the online lectures and all the online game, like whatever their schools are asking them to do through the Zoom platform or any other online platform. So not only kids, even adults also, those who are usually used to go to office or any other workplaces. So if their work is, just a minute. देखूँ तो just telling ना कि I am presenting, just to stop that. Excuse me, can you please just, I am presenting in webinar. Can you please just switch on this? I am just presenting in webinar. Extremely sorry. So these are the possible side effects of excessive gadget use: is the eye strain, dry eye disease, and myopia progression. So whenever you are in clinic, these are the very eye strain and dry eye. These are like very common. They usually complain about all of this. But myopia progression is not a new thing which come after this COVID situation. It's already uh, it's already was there, but due to this pandemic situation, so people has to like especially kids and like the school going children has to spend more time in front of computer or any other electronic gadgets. So they are and due to that there are like more chance that they will get myopia, and there are like more papers on that where you can see that these other things are happening. So and in eye strain and dry eye disease, so in due to this pandemic, as already I have told, it's because of excessive gadget use. So these are the very common complications which patient can tell you. So not only because of excessive gadget use, sometimes patients are coming with this kind of complication. So whenever they are coming to your clinic, you should while you are doing while you are checking their eyes, along with retinoscopy and other vision taking and all of that, you should check their 4-year status and near point of convergence, accommodative amplitudes, accommodation response, and accommodative facility as well. These are not the regular tests which we all are do in our clinics, but we should give importance to these parameters also, because uh, like as we already know that we have to spend more time in front of a computer, so we should take care of these parameters also, because if the patient is coming with a headache or coolingness or what to say, if they are complaining about eye strain or something. So if we will do just the quick retinoscopy and we will check their vision and all, and then we ask them, no, everything is okay, no, you can leave. I think that will not be a good step to do. Then we should check all these parameters. At least if we at least we can do a quick dynamic to check their lag and lead if they are having, because if we will do that, at least we can give them to relief. And for school going children, usually we should do the cycloplegic refraction, but after this situation, I think it should be mandatory, because until and unless you will not do a cycloplegic refraction, you will never get a correct or the actual refractive error which you should get. So I think these are the things we should keep in mind while we are treating or giving a spectacle correction or anything to school-going children. And even as though some practitioners are thinking like cycloplegic refraction is only for kids or school-going children or up to 16 years or 17 years, there is nothing like that. You can also do cycloplegic refraction for adults as well, even for the pre-presbyopic patient also. Before giving them any kind of near addition or anything, you should check is if they are uh, because you should not miss a small amount of hyperopic error, because a small amount of hyperopic error also can give asthenopic symptoms. So, so whenever uh, we are seeing any patient, we should keep in mind that we shouldn't miss any accommodative issues. We should not miss any uncorrected hyperopia, and along with uh, we should check their alignment as well, because sometimes if we will give them hyperopic correction, if we will give them all the refractive error whatever they are having, and we haven't checked their Fourier status, or if they are having any other uh, uh, we should check their Fourier status, because if they are having Fourier, uh, so they can that also initiate their uh, asthenopic symptom. So we should keep it mind also. And so talking about myopia workup guidelines. So as we all know that if it is So, as we all know, if it is progression myopia, then their axial length will get increased. So, in every visit, at least in 6 months of span, we should we should do a scan for them to understand if the myopia is progressing or not. And we should also ask the parents the importance of outdoor activity, because we already know that if the children will like previously when we used to go outside and play in our childhood or in our parents' childhood, so uh, in that time there was like less number of myopia patients. But in recent days, so the study suggested that within 2050, 50% of the population will get myopia. So it's more important that we should take it seriously, and we should ask the patient that whatever needs to be done, and the importance of outdoor activity as well. So we already know that now we should also maintain the social distance, but we can use our terrace or garden, so they can play there at least 1 hour, 2 hour with their own family members, so that at least they will get that opportunity to go outside or play around. So that will help them, and as well as visual hygiene during near work. So visual hygiene means, so whenever we are using any computer or any other electronic gadgets, we should maintain a proper distance, so that that will not give any strain to our eyes. So these are the things I think we should keep in mind. And this picture from WCO. So whatever I have told, like it's already there in this picture. So that's all from my side. Thank you.
Thank you so much, Ranindita, for your wonderful presentation. Our last speaker is Mr. Jiaul Baksh, who is a fellow in LVPEI and currently is working as a consultant optometrist in Narayana Nethralaya, Bengaluru. I would like to request him to please share his experience and thoughts with us. Please, Jiaul.
Yeah, thank you, Ronita. Am I audible?
Yeah, you are audible.
Okay, fine. So, thank you so much, HIM, for inviting me as a speaker. I think my previous panelists already discussed most of the thing. So, I'll just share my screen once again. My screens are visible, right? My slides are visible?
Yes.
Yeah.
Yes, it's visible.
So, I'll discuss about eye health examination and what I practice here in Narayana Nethralaya. I'll discuss about that. So, first of all, patient screening. So we are doing temperature checkup for each and every patient before checking in. And there is one self declaration form also to be signed by every patient. So in that, basically, we are asking that if they have any travel history, if they have any cold cough, or if they have any contacted with any corona patients. And second of all, third of all, we are not allowing any attender inside the hospital premises, except if it is a pediatric patients or patients with special needs. And definitely there is no entry without mask. So there is no entry without mask. So, and if there is no mask, then we are providing one from the hospital. So during patient evaluation, as a optometrist or primary care practitioner, we are also taking care, and we are using gloves, N95, mask, and face shield, and we are using slit lamp barrier as well. And we are avoiding any contact procedure like Goldman appliance tonometer if the non-contact tonometer values are normal. And cleaning of lenses and trial frames we are doing after each and every patient. Slit lamp, chair unit, door knobs, everything we are cleaning after every consultation. So these are the slit lamp barrier we are using, and we are protecting ourselves with face shield and mask like this. So what problems we are facing basically during patient evaluations are the trial lenses becoming foggy while doing subjective acceptance. So for that, we are asking patient to put a tape over their nose so that the airflow from there doesn't come up. Or other than that, we are telling them to little bit tighter so that the airflow doesn't come. And due to this, the average chair time of every patient is increased because of cleaning lenses and all these things. And sometimes while doing slit lamp examination, the eyepiece are becoming foggy, which is again problem. So that we have to clean it up. To clean it, then we have to restart our slit lamp evaluation. And I am basically doing retinoscopy 100 centimeter rather than 66 or 50 centimeter, and I'm doing and my working distance is 1 diopter rather than 1.5. But in these cases, there is high refractive error, or the glow is not that reflex is not that good, then understanding that it is little difficult. So either I have to come closer or I have to put higher lenses and check. So in this also, video consultation or tele-ophthalmology also helped us significantly. So specifically for emergency referral and advice, it helped us. And there are few drawbacks of all this also. So vision screening and refraction and IOP measurement is not possible by this. But yeah, for higher centers opinion or cross consultation, it is very important, or it is useful. So this is patient flow, what I have seen during this period of time. So 50%, as previous speaker also mentioned, that 50% of this case was a refractive error. And in that, I have seen significant amount of myopia progression during this span of time. And average screen time also increased by 4 to 6 hours due to online classes are going on. And second big thing is squint and binocular single vision. Squint is normal exotropia, and other than binocular single vision wise, I have seen significant amount of accommodative excess cases, and that is probably due to high uses of screen. And other than that, eye allergy and few of cases of glaucoma and retinopathy of prematurity also have seen. And this eye allergy, I specifically want to tell, we have not seen a single cases of corona positive in the eye allergy. Most of the allergies in the children were allergic conjunctivitis or bacterial conjunctivitis, but there was no positive cases of corona till now I have seen. And this is the patient's data, what I've seen from the 1st April to 31st August. I have been working during this time. So total patient I have, so this green bar is showing what patient I have seen in 2019, and this red bar is showing what I've seen in 2020. So the green bar is around approximately 50% reduced due to this corona. And in the phase follow-up patients also 50% reduced similarly. So total patients around 50% reduction. So this is an interesting paper which recent 3 days back published by American Academy of Ophthalmology. So they have done a survey in among pediatric ophthalmologists in USA. So pediatric ophthalmology in USA. So there are almost 75 million children. There are almost 75 million children there in USA. For them, only 1,000 pediatric ophthalmologists are there. So they have to, and most of them to do private practice. So for them, around revenue reduced to around 13%, and 50% of the ophthalmologists or co-workers have seen reduction in their salary due to this COVID shutdown. So they are really struggling to survive this COVID-19 shutdown. So how to protect your eyes and health during COVID-19? So I would recommend few things, like if you use contact lenses, then switch it to glasses. Although there is no proven study that contact lens wearer can have coronavirus, but yeah, so usually who wear contact lenses, they are more prone to touch their eyes. So it's better to stick to glasses for a while. And wearing glasses, if you don't have glasses, also wearing glasses can give you an extra protection, extra layer of protection. So that also will be really helpful. With zero power glasses also you can wear. And for glaucoma patients specifically, if they are not able to come or visit hospital, then they can stock up their medication, and they can delay their visit basically. And we should always avoid rubbing our eye. We have tendency to touch our eye in a minute around 4 to 5 times, so that we should completely avoid. And practice, we should wash our hands frequently, and as well as we should maintain social distancing. And regarding the I would thank you so much. So these are the reference, and thank you so much. I will happy to take any question if you have, and if you can share the questions, I'll be happy to take those questions.
Students, you can, if you want to ask, you can post some questions in the question and answer chat box. Thank you so much, Jiaul, for your enriching presentation.
Yes. And I think regarding the first question that if children are using gadgets, so I'll just briefly discuss what we suggest to children basically. So if they're using significant amount of gadget, I would recommend them to shift to a larger screen rather than smaller screen if possible, or if they can transfer it to television screen, larger television screen, and reduce their brightness to 0 or minimize the brightness. And other than that, the 20-20 rule, which is very useful, so they can at a stage they should not do. They should every 20 minutes they should take break. They should look at minimum 20 feet away distance, and they should restart their work. And they should put a time tracker on it. And ideal time, we tell children not to use gadget even half an hour if they have any glass power or anything. But as they're using now, they should do this thing. They should maintain this 20-20 rule to overcome that problem. Thank you.
Okay, Jiaul, we have another question from Mohammad Zakaria. Will you suggest any blue protection lenses in these days, sir?
So it again depends. So blue protection lenses, there are no true evidence that they'll protect from the blue rays basically. Although there are few suggestive articles which is showing this, blue protection lenses are useful. The problem is how many hours they use. So children, if they're using 1-2 hours, then it is definitely not necessary. If they're using for 8 to 10 hours of screen, there can be some amount of usefulness in those cases. But I don't suggest them. I would suggest rather than spending money on blue protection, they can buy expensive phone which have good amount of good retina, good quality of screen basically, rather than spending money on blue protection.
I would request the students to post your question with the panelist name. So Jiaul, I will ask you one question from Mukesh Jain. What is new in refraction at this situation?
So that's a very good question. So new eyes, we are not seeing nothing new. All follow-up cases of myopia or simple hyperopia cases are coming. But yes, there are significant amount of myopia progression and accommodative excess. So this is mostly due to high usage of gadget. So that is what we are seeing. And I have seen few cases of accommodative spasm also, when your lenses became spasm due to excessive usage of gadgets. I think anyone else want to add something, they can add.
If any other panelists can add, want to add anything else, they can definitely add.
Yeah, so as Jiaul said us, like as he is getting more patients related to binocular vision anomalies. Yes, it's true because in every institution it's same, because as they are using as we are using computers for longer time, it's very common as practitioner, we are getting more patients with binocular vision disorders as we will, if we will compare it if we will compare. So not only accommodative spasm, you will get convergence the people who are having convergence issues and accommodative infacility, because if you will use a computer for longer time and you will not take a break, then after so long hours, if you will just look straight, then you will get those kind of issues. So it's very important to follow 20-20 rule, as Jiaul also mentioned in his PPT.
Thank you, Ranindita. There is another one question. If blue protected lenses are not used, then what will you suggest for harmful blue rays, whoever is using the longer screen time?
So first of all, blue rays. Blue rays effect is there in macular degeneration or age-related macular degeneration. If they are using it for long, 15, 16 years, then only we see some changes in the macula. For that long exposure, ideally children, I don't think they'll have initially. So, and second of all, if they're using significant time, as I told before also, they can have blue protection lenses. But rather than that, I would suggest good screen quality, like Apple screen or Apple MacBook screen. They have Retina display, so they can use that. And that in that displays, the blue coating protections are already given, so you don't have any problem there.
Thank you, Jiaul. We have another question. How can I develop my eye power?
How? Sorry, that I could not get the question. How I can?
How can I develop my eye power?
Okay, so the eye power basically comes because of change in axial length or a smaller axial length, or there will be change in the corneal curvature. Probably he's asking that how after using gadgets or after using screen time, he's getting the glass power. So what happens basically, there is a significant amount of theory. First theory which I remember, or I can recall this, because of the because of using gadget, they're doing accommodation effort a lot. Because of that accommodation effort, the sclera over there is stretching. Because of the stretching in sclera, the eyeball's axial length also stretching. Because of that axial length change, the minus number comes specifically. So this is one theory I can tell, and that's the reason the eye power develops basically if you're using excessive. So that's why you see who reads a lot, and most of the doctors, they have eyeglasses. So that is the reason I can tell now. Yes.
Okay, thank you, Jiaul. Students, can you please ask any other question if you want to? We will wait for another 2 minutes and then we will end our session. Okay, we have got another one question. Should we wear contact lenses regularly?
So now, as I mentioned in my slides also, regularly contact lenses, there is no problem, or there is no proven study that if you wear contact lenses, you will get corona. But there are chances when we use contact lenses, we touch our eye significant amount of time, and while replacing contact lenses also, you have to touch our eye. So if you are not cleaning properly, if you get contacted recently with the corona patient, and if you touch your eye, then you might get corona. So I would not recommend contact lens now, but for now you can switch to glasses later. When all these things come down, then you can use contact lenses. But yeah, if there is high power and if you have RGP lenses, then there is no other option. You should go ahead and use contact lenses, but precaution wise, you clean your hand frequently.
Okay, thank you, Jiaul. Another question is, okay, Bibek has answered that question already. Thank you, Bibek.
Yeah, I have
any other questions? Okay, so the question was, what should a spectacle wearer do to avoid fogging while wearing mask? And Mr. Bibek has answered that: tape the mask and use glasses. Thank you so much, Bibek.
Welcome.
And someone wants to know about blue cut lenses.
Vivek, would you answer? Okay, fine. Blue cut lenses basically the lenses which cuts blue rays basically from the gadget or from the computer screen. So that is invisible though. We cannot see in a naked eye that what is blue rays or what blue rays are coming from screen. So there's special coating there in the glasses. From that coating, it cuts down that blue rays. Not even 100%, 99.99% approximately amount of that. I cannot recall that again. So approximately that amount it cuts that blue rays, and that helps in reducing the blue rays from the computer screen. So what blue rays does basically, so if you can have variable sleep pattern if you are using screen before sleep basically. So for that reason, if you give blue cut lenses, then that will cut the blue rays from the screen. So you will not get strain and other blue rays, harmful blue rays from the computer screen. So it will be easy then.
Okay, thank you, Jiaul. We will take another question and then we will end the session. One student is asking that if 99% is carded, if 99% carded, then we should get color deficiencies. How possible is it, sir?
No, so that is so that they are cutting down only blue rays. So from cutting down blue rays, there won't be any color. So that is not in visible spectrum basically. So that you can't see. From that, color deficiency won't be there. I guess so. That would be the answer. Yes.
Okay, thank you. Thank you so much, Jiaul. Thank you, everyone. We appreciate you being here. Thanks again for joining us today. We are looking forward to organize such thoughtful and insightful webinars, and we wish for your kind cooperation in future also. Thank you, Ranindita. Thank you, Jiaul. Thank you, Saptak. And thank you so much, Bibek. Thank you so much.
Thank you. Thank you.
So we are ending the session. Thank you so much.